Welcome to today's webinar, Getting the Information and Resources You Need for Child Care Recovery and Stabilization. As New Hampshire's child care system and programs transition from emergency to recovery and stabilization, providers will need information and resources in order to serve children and families in a safe and healthy environment. This is part of a webinar series and is our 9th session within the series. We will be offering the series as recorded webinars versus live. Information regarding the next webinar will be provided at the beginning of each month through Child Care Aware of New Hampshire's e-news. I'd like to welcome you to this month's session. My name is Tracy Pond. I'm from Southern New Hampshire Services, and I'm the Program Manager for the Child Care Aware of New Hampshire program. We are a statewide program funded through the Bureau of Child Development and Head Start collaboration. Through this program, we support families in their search for child care and school-age options. Additionally, we support early childhood providers through training, technical assistance, consultation, and coaching services. We are pleased today to be able to host the recording of this webinar. To obtain professional development for the viewing of this webinar, please use the self-study sheet found at the top of the training webinar page on the Child Care Aware of New Hampshire website, now nh-connections.org. This presentation is recorded and questions will be posted on the New Hampshire Connections website. Currently, the website, if you go to the current website, the previous website, childcareaware.org, it will redirect you to the New Hampshire Connections website. If you are having trouble accessing any information while viewing this webinar, please contact Child Care Aware of New Hampshire at 603-903-0830 or call toll-free at 855-393-1731, extension 2532. If you have questions after this webinar viewing, please send them to eccp@dhhs.nh.gov. We will be compiling a question and answer into a frequently asked question document, and we will post that on the Child Care Aware of New Hampshire website as soon as possible. We have a selection of speakers today providing updates and information to support your work. Today's speakers in order are myself, Tracy Pond with Southern New Hampshire Services, Child Care Aware of New Hampshire. From the Department of Health and Human Services, we have Deborah Nelson, Bureau Chief of the Bureau of Child Development and Head Start Collaboration. Diane Chase, Assistant Bureau Chief of the Bureau of Child Development and Head Start Collaboration. Melissa Clement, the Unit Chief of Child Care Licensing. Denise Martin, the Professional Development Specialist from the Bureau of Child Development and Head Start Collaboration. And Emma Salerni, Administrative Assistant at the Bureau of Child Development and through the Preschool Development Grant, University of New Hampshire. Here is our agenda for today, outlining the updates being provided with a special emphasis and update on the New Hampshire Connections Information System. Deborah Nelson will be providing the Department of Health and Human Services update. Diane Chase will be providing the update for the Bureau of Child Development and Head Start Collaboration. The Child Care Licensing update will be provided by Unit Chief Melissa Clement. The New Hampshire Connections Information System will be addressed by Denise Martin. I'll be providing the update on services and programming provided through Child Care Aware of New Hampshire. And Emma will be assisting with any questions and any technological difficulties. First, we welcome Deborah Nelson, Bureau Chief of the Child Development and Head Start Collaboration Office, to provide her update. Welcome, Deborah.
Thank you, Tracy, and hello, everyone. Thank you so much for joining us for our webinar today. Today, I have a few brief messages by way of DHS update. First of all, I would like to share with you from all of us at DHHS that we are thinking of you. You're in our thoughts during this unsettling time as COVID infections spike and the future feels uncertain. We know you have been struggling and working and overcoming challenges for the almost 9 months of pandemic now, and we know it's not over yet and it's spiking and you face new challenges, but we are with you on this journey. So please know that we're thinking of you, and we really hope that you will take time during this stressful time as things spike once again to take as good a care of yourselves as you do of the children and families you serve. That's so important, and we understand it's hard to do. So second, I'd like to share with you just a few statistics on how the department has been helping programs and individuals and families through the pandemic statewide. First, the Housing Stability Program through DHHS has provided support to 1,990 people to help keep them in their homes and help them to acquire housing or stay in their homes during the pandemic. Now, hopefully you've seen the flyer that the Housing Supports Bureau issued, and if not, it's posted on the New Hampshire Connections website. And we can provide a link for you where exactly that is located later. And it's important to know that Gopher funding, which supports this housing supports program, is ending soon. So if your family or any of the family's children you serve, your neighbors, anybody you know is struggling with housing, may lose their housing, may have trouble staying in their housing, please refer them to that program. And that can be reached through www.capnewhampshire.org or by calling 211 from any New Hampshire phone. And it's also important to know that the eviction moratorium, which has been in place throughout the pandemic, is ending on January 1st, 2021. So all the more reason to be aware of the Housing Stability Program and refer anybody to that program that you think might benefit and need support from it. Secondly, the CCRSP, Child Care Recovery and Stabilization Program, has provided support to over, many programs, which has resulted in 45,000 childcare spaces being maintained and available statewide. And thirdly, through the pandemic, the Electronic Benefits Transfer Program has provided support to purchase nutritious food for more than 27,000 children in almost 16,000 households. And that's so important. We know, during the pandemic, getting nutritious food can be really a challenge for everybody, and particularly if you need support for purchasing food. And next, the Bureau and our partners are really committed to continuing to keep you informed during the pandemic, and particularly to make sure that we're sharing the latest information and guidance from public health. We understand that on the Early Learning New Hampshire webinar recently, Dr. Chin presented information on the guidance, and public health promised to answer your questions that they were not able to get to and respond to on the webinar and publish an FAQ. So stay tuned. As soon as we know that's available, we'll make sure it gets posted. So how will we continue to make sure that you're informed? We will be recording these webinars monthly that you may listen to at a time convenient for you and respond to your questions just as we have in the past. Once you submit them, then Child Care Aware will send them to us, and we'll make sure that you get your answers. Together with our partners, we will continue to email you updates and post updates on emergency policies and opportunities that may be of interest to you. We will also continue to post information online through DHHS as we revise our website, and through New Hampshire Connections, and through other partners that have websites that post for us. So, and of course, you can always reach out to any of us through email or phone calls, and I know that you have our contact information. So lastly, would you please move the slide forward, Tracy? Thank you. So lastly, I wanted to mention many of you were able to respond and very quickly, for which we thank you, to the survey that we put out in partnership with Child Care Aware on the Office of Child Care's PPE cleaning and disinfecting supplies program, because we had gotten word that they wanted to ship PPE and supplies, cleaning and disinfecting supplies, to states for childcare programs. And so they wanted to know, what you all needed. So you all kindly, or many of you, responded to that survey. Well, unfortunately, after we submitted the information, we got word from the Regional Office of Childcare that the national office no longer plans on doing that. So our apologies that we couldn't be, that wasn't going to be followed through on. I'm sure they had good reasons. I wonder, having been a state that, and Denise Martin can attest as our person who was the queen of the supply distribution for us, getting many, many, many supplies out to all of you. It is a very challenging operation, and I'm wondering if the national office, just realized how difficult it would be to do that from the national office. But your answers will not go, you did not do that for nothing, because by answering that survey, you gave us important information on what your needs still are. So as we have opportunities to respond to your emergent needs throughout the pandemic, we will keep that in mind. And if there's any way that we can allocate more support for supplies in some way, then we will do so, including through one of our COVID initiatives that is going through childcare. We have New Hampshire, the e-collaboratives, and where the collaboratives are looking at how can they be supportive of disseminating needed supplies to all of you. So again, thank you. And lastly, we just want to thank you again for listening to our webinar. And at that, I will turn it back to Tracy. Thank you, Tracy.
Thank you, Deborah. Our next speaker is Diane Chase, Assistant Bureau Chief of the Child Development and Head Start Collaboration Office, to provide her update. Welcome, Diane.
Thank you, Tracy. You can forward the slide for me, that would be great. Terrific, thanks. So same thing as Deborah in terms of just a few updates to let people know where we are. I first of all want to say thank you. I've had the pleasure of speaking with probably 75 or 80% of you over the last few months, and always appreciate your patience in us getting back to you, and your good insight, your excellent follow-up, and it continues to be appreciated, as well as the frontline work that you all are doing. So some updates on the CCRSP program. Just want to remind you that all invoices are due already, so you need to get those round 1 and round 2 invoices in. There was some confusion where people thought the round 2, we were actually referring to the second invoice in round 1. Unless you were a summer program, you should have gotten 2 award letters for CCRSP. Your first award letter, which had 2 invoices, which were 60% in the first one and 40% in the second one. And a second award letter, which was considerably less. It was 30% of the original, approximately, and that had a single invoice. That's known as the round 2 invoice. Both of those need to be submitted. If you have some confusion about either whether you've submitted them or not understanding whether you got that second award letter, please reach out to that ECCP at dhhs.nh.gov email address, and we will get back to you. Tori Black is handling those responses and has been able to walk a couple people through some of the challenges that they've had, either with completion or submission or tracking. And we need to get those in. Do not forget, this is not a reimbursement program. What you're doing is you have allowable uses, you have income losses, and you have COVID-related expenses. So once you have identified your allocated use, for example, if your award was $50,000 and you had $35,000 of income loss that you documented, then when you get your check, that $35,000 automatically goes into your account to be used in whichever way you need to use it for your program. So keep that in mind. If you have any questions about the spending, again, please reach out to us. We'd be happy to help you. Just to note that both the CCRSP, actually all 3, CCRSP, NHEYP, and the new CCCAS programs will all have a final report due on January 15th. Prior to that, we will be releasing a copy of the final report. And for those of you that did the CCCAS application, you're already halfway done. You'll just need to update their financial numbers. There'll be some additional questions. It will be an online response, and we will be having on December 16th, Wednesday, we will be having a 12:30 webinar explaining how to complete that report. In addition, we'll be reaching out to our partners of Child Care Aware and Early Learning New Hampshire to assist us in helping you complete those final reports. One of the things I want to remind you for, again, any of these 3 programs, we will not be asking you for copies of your receipts, pictures of equipment that you bought or spaces. We certainly will ask for the anecdotal part of what's going on in your programs and would love to share some of the innovative ways that you have addressed the pandemic in your program. But that is not a requirement in any way, shape, or form in the final report. You will be telling us what you've done with the COVID money and how it has, or the CARES Act money, and how it has impacted your program. In addition, you'll be telling us as you're looking forward on additional challenges that you'll be facing, because this is key information that we'll be able to provide when asked by the federal government or the state. NHEYP, almost all of you have turned in your invoices, agreements, as well as your SAMS number. I can never remember that. And so those funds should be going out. There are some third party, not related to us, advocacy going on to try to identify continuation money. If you have interest in finding out more about that, you should reach out to Chris Eman at the Boys and Girls Club of Central New Hampshire, and he can tell you more about that. Now, let's talk about the newest. The CCCAS, which is the COVID-19 Child Care Assistance Supplement. And that is $10 million additional money that came down the road. Those applications closed at the end of October, beginning of November. All of the reviews, except for 9 programs, have been fully completed at this point, and those 9 programs are just making some tweaks in their worksheet. So this is very exciting. Many of you who are listening to this call have already received your award letter. We had 252 applications when all was said and done, with some duplicates, as well as one that was ineligible because they were not previously a CCRSP. We ended up with about 247 applications. The amount of money that was overall that was asked for was around a little over $46 million. That all of you expressed that you were had COVID-related expenses and income losses for those around 250 programs. That resulted in each program that is funded receiving 21% of their initial, what we call their ask, what funds they requested. We're very excited to be able to get that out the door. If you have received your award letter, it had an invoice and instructions attached. It's just like your CCRSP invoice. Plug in your award amount, you send that into the ECCP invoices mailbox, and we will log it in and process that and get it through finance as quickly as possible. That will also be included on your final report. So as part of the CCRSP money. And we'll talk more about that on the December 16th webinar. If you have not heard from us by, let's see, before Thanksgiving, by the week of Thanksgiving, if you've not heard from us on that Monday, please send us an email and let us know at the ECCP mailbox that you have not received your award letter or a notification as to your funding status. Last but not least, the market rate survey. Unfortunately, or fortunately, we still have to do the market rate survey in a traditional way for this year, since we told our federal partners that's how we are going to do it. We understand that you all have survey fatigue, and so we've decided to push that off until January 18th. So the will come in the mail to all programs across the state on January 18th. Please watch for that, complete it, and get it back to us as quickly as possible. This is key in our preparation of our new CCDF plan that we present to the federal government, and we need that information. In the future, that information will be collected through the information system that Denise will be talking about. So that's an exciting opportunity for us to collect ongoing information. And meanwhile, we're going to do it old school. And so watch for that in the mail. The final thing is thank you to all of you who participated in the workforce survey. I know that some of you were disappointed that you missed the opportunity. Again, the exciting part of this is that while we have a baseline information, you do have the opportunity, if you wish to send us, and please send it to Diane Chase. It's diane.chase@dhhs.nh.gov. Please feel free to send me an email about about workforce, whether it is from a director standpoint or whether it's from an individual employee standpoint, as to your concerns, your pay, the challenges. I'm happy to have that because that information also becomes part of the picture that we can paint of our workforce in New Hampshire. In the future, that workforce survey will be conducted through our new information system, and hopefully we'll be able to do it on a much more regular basis. So when we do have inquiries from legislators, department heads, external resource folks, nonprofit, philanthropies, then we'll be able to say, this is where our workforce, our childcare workforce is sitting in New Hampshire, and these are the challenges they're facing. And then back that up with good solid data. That's all I have to add. Please feel free to reach out to us at any time. And again, I appreciate your patience. We are averaging a huge volume of emails and phone calls and on a daily basis. And I think we're probably going to continue to do that. So don't hesitate to send us another email and wave a red flag. Tracy?
Thank you, Diane. Our next speaker is Unit Chief Melissa Clement from Child Care Licensing. Welcome, Melissa.
Thank you, Tracy. Hi, everybody. Nice to be with you virtually. And a couple of things that I want to give some updates on. Obviously, this is being recorded the day after the governor announced that there is a new statewide mask mandate. And I want to read from his emergency order to help clarify what that means for childcare programs. So the emergency order is number 74. And in it, there's a number 3 that says, this order is not intended to override any provisions related to the wearing of masks and cloth face coverings that are contained within industry-specific guidance that is part of Exhibit B to Emergency Order 52. In any situation where the provisions of such industry-specific guidance conflicts with this order, the provisions of such industry-specific guidance shall control. What that means for childcare is that you are to follow the public health child care guidance that has been issued under the emergency or Exhibit B of Emergency Order 52. So that is the child care guidance that you have been following all along. And that is the guidance that is specific to the mask wearing that you need to follow in your program. So no changes. That order, the emergency order that came out on Thursday, November 19th, does not impact what you are following currently in your program. The other update I wanted to mention about public health is I sent an email to all licensed childcare programs in order to better facilitate communication when you have a positive case that has been identified in your program when you are calling public health. The public health number to call is 271-4496. That has not changed. But what we have heard from public health in our conversations with them is that sometimes when messages are being left, it is not always clear on the message that you are from a child care program and that you're calling because you have a positive test or case of someone in your program. Without that specific information, you could be placed in a queue of calls that they are returning just for people who have general questions. So it is extremely important in order to get a call back as quick as possible from public health, which they say would be within a day, when you have a positive test in your program that you specifically say you're a child care program and you have a positive case in your program. That way you'll be able to get the call from them with the guidance that you need. And in addition to that, make sure that when a staff tells you that they have tested positive, even if they have said that public health has called them, it doesn't always mean that public health has made a connection that they work at a child care program. You would hope that that would be there, but on the case that it isn't, because they're dealing with such a high volume of calls. Also, when you call the program and you have a staff who's positive, make sure you tell them that so that they will understand that the positive result for that staff that they have in their system, that person works at a child care program. They're not necessarily getting that information when they get the test results for individuals. They don't always know their occupation, but it is a high priority for them to do contact tracing for individuals younger than 18 and for people who work in settings such as childcare. So it's extremely important that they have that information from you as well. Moving on from some public health issues, part of an emergency order that was issued by the governor allows us to renew licenses without having a complete application or without us completing our specific visit for that, so your license does not lapse. So what we are doing now is we are sending out with your application materials a license that has been renewed due to this emergency order. Please, when you receive that information, if you have a license that's going to be expiring in the next year, that you read the information that's in there. The letter details why it's being issued as now and what you will need to do when the emergency order is over. If you have any questions, of course, please contact our office. But in addition to that, as part of the letter, we also strongly encourage you to complete your application and get your local approvals done, if at all possible, and not wait until the emergency order is over. So that way your officials in town are not getting inundated potentially with lots of requests at the last minute for approvals after the emergency order, and so that no one is being rushed. So if your community is one where you're able to get your fire and health approvals completed, we highly recommend that you do that as soon as possible so that we are not waiting till the end to have all this completed. In addition to this, on a call that was with the Early Learning New Hampshire and others on Thursday afternoon, November 19th, we heard from many of you of the struggles that you're having with getting qualified staff in your program, and that you have assistants who are currently working in your program, that you would want to be able to be considered associate teachers while we're in the staffing crisis. We are working through that with our legal counsel here in order to get that completed. And I hope to have an email out to you, if not Friday, which is today, November 20th, depending on when you're listening to this, or by next Monday, in order to have a process for you to complete those waivers to us, and so we can turn them around quickly. We're trying to make sure that this is something we can do as quick as possible using the emergency order guidance that we have, and in consultation with our legal department to have these waivers approved quickly. So with that, I just want to say that I am extremely thankful for the work that you guys are doing out in the field with the families and the children you serve. I appreciate the grace that you are receiving the licensing coordinators in your program. I've received many visit assessments that say how good the visits are going and that they're being extremely respectful, and I certainly appreciate the goodwill that we are getting from the field. So I'm extremely grateful for that right now, and I hope you have a wonderful Thanksgiving. Thank you. Back to Tracy.
Thank you, Melissa, for that timely update. Next on the agenda is Denise Martin, Professional Development Specialist. from the Bureau of Child Development and Head Start Collaboration, who's providing information on the New Hampshire Connections Information System. Welcome, Denise.
Thanks so much, Tracy. Could you advance the slide, please?
I'm trying to, but it's not.
Okay.
I will keep
Well,
trying.
that's okay. I will start sharing the information I have to share, and the slides can catch up with me when they're ready. So thank you for having me here today. I'm excited to provide you with a general overview of the New Hampshire Connections Information System to let you know what components of that system are available to you now and what components of that system are up and coming. And so the New Hampshire Connections Information System is a multi-component system. It will be taking the place of what we currently refer to as the registry, but expanding to offer so much more. Next slide, when the slides are ready, please. Wonderful. New Hampshire Connections Information System currently is working on rolling out 7 components. And so when a provider logs on to the system, and we'll talk in a few minutes about how we can do that, they will be on this landing page. And so this landing page, back one slide, please. This landing page shows a tile or a component for each portion of the system. And so you can see in the lower left-hand corner, the child care profile or the program profile. That component is available now, and we'll spend some time teaching you a little bit about that component. The other components that you see, the professional registry for individual professionals in our state, credentialing, training, licensing, background checks, and eventually QRIS are all parts of the system that are being developed now, several of which will be rolling out in the month of December. Next slide, please. I will start sharing out the next slide, and those slides can catch on up to me when they can. And so this is perfect timing, a program profile. Each program in our state has a profile about their program within the new system. And so families and guardians who are searching for quality childcare search by radius, by geographical location, by quality indicators, etc., and then are provided with a list of programs that meet those qualifiers. When they click on a program, this is an example of what they might see. And so all programs are represented by a program profile based on information provided by licensing. And so you can see a very basic landing page here with information that allows a family or guardian to have a quick overview of a program and reach out to contact them. Next slide, please. Here's where things get exciting. Every program in our state can log on and access their program profile to highlight what makes their program unique or special or may meet the needs of individual families. And so you can see there's a navigation tool that I've provided a snippet of here. So you can see what kind of information you as program leadership could opt to include on a program's profile. You can offer more expansive information about your hours of operation, including any temporary changes in your hours of operation for a snow day, an individual emergency, or a greater emergency like COVID. You can choose to provide information about your rates. You can see that there will be licensing history information provided there. Programs can update their availability. And eventually their QRIS rating you can see down there at the bottom. And so here's a really nice opportunity for programs to use their program profile within that child care search to market to potential families and also to communicate to current families. Great, next slide, please. Neat. So programs in our state fall into one of 2 categories with regards to their access to the system as of today. Some families, some providers have already logged into their program profile and even done some of that important updating. For those programs, if you've logged in once before and would like to log in again to continue to update your program profile, you can do so by following the link on the Child Care Aware website. For providers that have not yet accessed that system, we will be sending an email out either later today, Friday afternoon, depending when you're watching this webinar, or Monday morning. That email will come from our partners at Salesforce and provide you with a live link that you can click on and access your program's profile for the first time. There you'll be able to make all of the changes that we highlighted in the last few slides. Neat. Next slide, please. Neat. And so what's next in the New Hampshire Connections Information System? We are looking at an early December rollout of a few additional components. First and foremost, the professional registry. The registry will be the first opportunities for individual professionals in our state to go in, to either access their prior account or establish a new account if they've never been part of our registry before. And it is within that registry that they'll be able to log their professional development, their employment experiences. At the same time, we're looking to roll out a credentialing opportunity, and that is exactly as it sounds, an opportunity to online apply for new credentials or to reestablish prior credentials. We're also looking to roll out a training component. And so that training component will include all of the calendar-based opportunities that our partners at Child Care Aware of New Hampshire plan for, as well as those opportunities for technical assistance provided by our partners at Across New Hampshire and PTAN. It will also provide links and ways to access our free trainings at Pro Solutions. Neat. So we're very excited to continue rolling out additional components of the system to you over the next few months. Please be on the lookout for program leadership in your emails for reminders, additional opportunities to participate in the system. And I think that's all I have for you today. I'm going to hand it back over to Tracy. Thank you.
Thank you, Denise. That's really exciting information. We're really looking forward to the New Hampshire Connections Information System to be completely rolled out. So I'll be providing a brief update on services being offered through Southern New Hampshire Services, Child Care Aware of New Hampshire. Child Care Aware of New Hampshire will be providing technical assistance and consultation on the New Hampshire Connections Information System throughout the course of this transition, as Denise outlined. Over the course of the next few weeks, Child Care Aware of New Hampshire is contacting programs to assist them with this feature and to help them have complete profile information available to ensure that families have full program information. So please assist us in helping you provide the most up-to-date and thorough information possible to families seeking child care by returning phone calls and responding to that as well. When accessing the Child Care Search Portal, you'll be able to find this portal on the new consumer education website through Child Care Aware of New Hampshire. This new website was launched on November 18th. So please note that if you go to the former website, www.nh.childcareaware.org, you will be automatically redirected to the New Hampshire Connections website. This site is www.nh-connections.org. This will assist you in a smooth transition for folks accessing any and all information tied to the New Hampshire Connections Information System and to the Child Care Aware of New Hampshire programming and services. So unfortunately, my slide is not moving over, so I'm not able to show you the next slide, but I'm going to keep going over my update. So to celebrate and engage you in the new site, we will be holding a website prize giveaway contest to entice you to navigate the site and explore what information and resources are being provided on the site for families, providers, and the community. Thank you, Emma. We have held a website information session last night, and we're holding another website information session with a guided tour of the site on December 3rd from 6:30 to 7:30 p.m. with our training and marketing coordinator, Jen Gannam-Smith. We'll be recording this session that will be placed on our website for those wishing to view it on their own time. As you know, Child Care Aware of New Hampshire provides a training and technical assistance program through what we refer to as our progressives. The progressive training and TA program is a unique program that supports childcare programs to implement new processes and procedures through training and technical assistance. It's informative and it really helps programs elicit change in their practices around different initiatives. So some of those initiatives include emergency preparedness, early learning standards, there's an infant toddler team initiative, strengthening families, environment rating scales, and a overview and introduction to the pyramid model. So if you'd like to obtain support and professional development through training and coaching technical assistance, we are now providing those progressives within an open enrollment process. So you can enroll at any time for any of those training and TA options. Once you enroll, we'll assign a training and TA specialist to you and your program, and then we'll start providing you with professional development information, and then help you with implementation assistance on the option your program chooses. We have several upcoming special events that we'd like to share with you. On December 5th, we are providing one of our active collaborative training series on neonatal abstinence syndrome. On December 12th, our training focus is geared to infants and toddler educators as we offer our Infant and Toddler Training Institute with Scott Noyes on brain development. On January 23rd, we are bringing a virtual conference to New Hampshire through our Keys to Quality conference, which was formerly referred to as our Caring for Our Children conference. In terms of VROOM, Child Care Aware of New Hampshire is excited to be partnering again with Child Care Aware of America on another initiative. We are working with other state child care resource and referral agencies throughout the country on embedding VROOM into their work through communities of practice. In addition, we have moved from being referred to as VROOM visionaries to champion brain builders with the incorporation of Mind of the Making to the VROOM activities. As we've mentioned in past webinars, we are also working with local lead partners to assist with regional capacity to meet the changing needs of families, businesses, and communities by developing strategies and implementing local solutions to COVID-related challenges. This has included the formation and facilitation of an e-community collaborative with regional representation from family resource centers and early childhood coalitions. Through this work, we are providing training, technical assistance, coaching, and support. In addition, we are working with Pro Solutions to have customized training specific to COVID-related topics tied to social emotional development, resiliency, and we hope to have a training package for directors and administrators. We have been conducting a survey on program experiences during COVID. If you haven't done so already, please complete this survey. We're hoping to utilize that survey to have a stronger understanding of the impacts that COVID has had on the field. If you need access to that survey, please email our training and technical assistance email at ccrrtraining@snhs.org, and a staff member will get that information to you. This concludes the Child Care Aware of New Hampshire update. In terms of questions and comments, after you view this webinar, if you have any questions, please direct those to the eccp@dhhs.nh.gov email. We'll be posting answers to any questions on the Child Care Aware of New Hampshire's website. Again, that new website is www.nh-connections.org. If you utilize the former website, nh.childcareaware.org, that will redirect you to the new site. So in closing, just want to thank you all, the speakers today, for their updates. A special thanks to the providers who provided us with some questions in preparation for this webinar. It's very much appreciated. Just another reminder, to obtain professional development for the viewing of this webinar, please use the self-study sheet at the top of the training webinar page on the New Hampshire Connections website.
And Tracy, this is
Yes.
Deborah. If I just may add, if you send us questions after the webinar that you'd like to have answered to the ECCP mailbox, because that mailbox gets so many emails, it would be very helpful to us if you put in the subject line, question from November 20th webinar, and that will really help us direct your question to the right person to get a timely answer. Thank you.
Great. Yeah, that's helpful to categorize the right line to find that information. So information regarding the next webinar will be provided at the beginning of each month through to the Child Care Aware of New Hampshire's e-news. Please send any questions again to the ECCP email. All recordings will be posted on the nhconnections.org website. It's under a page under our COVID-19 tab. This page will be populated and up within 1 business day. So please note that this website, again, is changing to NH Connections, and that new website address is www.nh-connections.org. We hope this webinar has provided you with the necessary updates that you need to support your work with children, families, and your staff. Our next webinar will be available in mid-December. As you know, it's the season to count our blessings and to give thanks. We wholeheartedly want to thank and acknowledge all that you do and have done to support children and families. Be safe and well, and we hope you enjoy your holiday season with your families. Thank you.